Hello and welcome. Today we'll be diving into a common yet serious condition, urethral obstruction. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. So, let's get started. Urethral obstruction at its core is a blockage of the urethra. This blockage prevents urine from flowing freely from the bladder to the outside of the body. The causes can be varied. In men, benign prostatic hyperplasia, or BPH, where the prostate gland enlarges, is a leading cause. Other culprits include urethral strictures, which are scar tissue that narrows the urethra, prostate cancer, bladder stones that have migrated into the urethra, blood clots, and even certain medications that can affect bladder function. Rarely, it can be caused by congenital abnormalities present from birth. Now, let's talk about what happens when the urethra is blocked. As urine backs up, pressure increases in the bladder. This can lead to bladder distension, where the bladder stretches beyond its normal capacity. Prolonged obstruction can cause backflow of urine into the ureters, the tubes connecting the kidneys to the bladder and eventually into the kidneys themselves. This backflow, called hydronephrosis, can damage the kidneys over time, potentially leading to kidney failure. The increased pressure can also weaken the bladder wall, increasing the risk of bladder infections and urinary incontinence. Urethral obstruction affects different populations differently. As mentioned earlier, BPH is a major cause in older men, making them the most commonly affected group. Urethral strictures can occur in both men and women, often as a result of injury, infection, or prior surgical procedures. Congenital obstructions are obviously found in infants and children. Statistics will vary based on region and age group, but the overall prevalence underscores the importance of understanding and addressing this condition. The signs and symptoms of urethral obstruction can vary depending on the severity and duration of the blockage. Common symptoms include difficulty starting urination, a weak or intermittent urine stream, straining to urinate, a feeling of incomplete bladder emptying, frequent urination, especially at night, nocturia, urgency, and sometimes even pain or discomfort in the lower abdomen. In severe cases, complete urinary retention, meaning the inability to urinate at all, can occur, which is a medical emergency. Diagnosing urethral obstruction involves a thorough medical history and physical exam. A urine test can help rule out infection. Post-void residual measurement, either with catheterization or ultrasound, determines the amount of urine remaining in the bladder after urination. Uroflowmetry measures the speed and volume of urine flow, indicating any obstruction. Imaging studies, such as ultrasound, CT scans, or MRIs, can visualize the urinary tract and identify the location and cause of the blockage. Cystoscopy, where a thin, flexible tube with a camera is inserted into the urethra, allows direct visualization of the urethra and bladder. Urethral obstruction can be classified based on the cause and location of the blockage. For instance, it can be categorized as intrinsic, meaning the blockage is within the urethra itself, so like a stricture, or extrinsic, meaning it's caused by something pressing on the urethra from the outside, like BPH or a tumor. Obstructions can also be classified as partial or complete, depending on the degree of blockage. Additionally, congenital obstructions are separated from acquired obstructions. Treatment for urethral obstruction aims to relieve the blockage and restore normal urine flow. The specific approach depends on the underlying cause. For BPH, medications like alpha blockers or 5-alpha reductase inhibitors can help relax the prostate or shrink it, respectively. Minimally invasive procedures, such as transurethral resection of the prostate, CTURP or laser prostatectomy, can remove obstructing prostate tissue. Urethral strictures may be treated with dilation, where the urethra is widened, or urethroplasty, a surgical procedure to repair or reconstruct the urethra. In cases of complete urinary retention, a catheter is inserted to drain the bladder immediately. Bladder stones are usually removed with cystoscopy or surgery. Any underlying infections are treated with antibiotics. Preventing urethral obstruction can be challenging, as some causes are unavoidable. However, maintaining a healthy lifestyle, including a balanced diet and regular exercise, can help reduce the risk of BPH. Practicing safe sex can help prevent sexually transmitted infections that can lead to urethral strictures. Prompt treatment of urinary tract infections is also crucial. For individuals with a history of urethral problems, regular follow-up with a healthcare provider is essential for early detection and management. The prognosis for urethral obstruction depends on the underlying cause, the severity of the blockage, and the promptness of treatment. Early diagnosis and appropriate management can often prevent serious complications and restore normal urinary function. Untreated or prolonged obstruction can lead to kidney damage, bladder dysfunction, and increased risk of infections. Recent research is focused on developing less invasive and more effective treatments for BPH and urethral strictures, including novel drug therapies and advanced surgical techniques. Ongoing studies also investigate the genetic and environmental factors that contribute to these conditions, paving the way for better prevention strategies in the future.